We start in today X-ray session. Okay, the first X-ray is this chest X-ray. This patient is 65, male with hemoptysis. What's wrong?
Yes.
This is a lateral chest X-ray of the chest, showing the sternum, and this is the vertebrae, and this is the mediastinum. This is the oblique fissure. This fissure is the oblique fissure, and imaginary here is the transverse fissure. This is the heart of the patient, and this is the hilum of the patient, and this is the anterior mediastinum. This is the middle mediastinum, and this is the posterior mediastinum. Any mass in the anterior mediastinum here in this black area, we should put differential diagnosis of what? Masses. This is the heart. Any mass there in the anterior mediastinum, we put
T.
Sorry?
نسميها 4T أو 5T.
5T.
5T اللي هي تيومر اللي هي ثايموما ثايرويد.
First of all, thyroid. Here in this area, retrosternal thyroid. 2, teratoma. 4, 3, what?
Thymus. Type of lymphoma.
Thymus.
Thymus.
4,
tumor.
Trauma.
5, terrible lymphoma. Terrible means serious. Okay? If this mass in the anterior mediastinum is starting from the sternum till the heart. This is the heart. This is a lateral chest X-ray diagram. Okay? Any lesion in this middle mediastinum, it means either heart lesion or hilar lesion. This is the hilum also here. Just in this case, this is showing enlargement of the hilum with multiple lymph node enlargement or tumor enlargement in the hilum. This is indicating that this case is a bronchogenic carcinoma. Any lesion in the posterior mediastinum, this is posterior mediastinum. What we get in the posterior mediastinum? We get a vertebrae. This is a vertebrae. We get the esophagus. We get the aorta there. Therefore, diseases of these 3 or 4 organs there. Any hernia, diaphragm hernia, might show a mass there in the esophagus. Any dissecting aneurysm in the aorta, it might show in the posterior mediastinum. Any vertebral disease, tumor, masses, paravertebral abscess, any neurological masses or tumor, neurofibromatosis and neurofibroma in this posterior mediastinum. Therefore, this is a lateral.
diaphragmatic hernia only بالرايت سايد مو؟
diaphragm hernia usually بالleft. I mean hiatus hernia in this area usually in the left-sided. As we said in the previous lecture, we said any pleural effusion specifically in the left side, it means either esophagus or the aorta or pancreatitis. this patient got a mass there and it turned to be odd cell carcinoma. You see this rounded mass is there and spiky هذا الماس هذا spiky out. This is the heart. هذا heart.
Yes.
A spiky area.
بس هم هاي ذات
اكو هنا تو ماسس.
Yes.
هذه.
بس هذه الاوبليك والترانسفير شفت الشيء بدون
Okay. هسه كذا chest X-ray.
نايس هاي.
The second chest X-ray is an 11-year female, child female, presented with weight loss, febrile cough, and hemoptysis once. And this is her chest X-ray. As we said, either we go directly to the obvious lesion to describe it, or we go systematically. As a trachea is central, the heart is normal, clavicle there, this is abscess of the lung, this is upper zone, mid zone and lower zone, this is the breast shadow, and this is the gas of the stomach, this is the left diaphragm, and this is a big cavity, nearly 6 centimeter diameter with empty cavity, thin wall cavity with tissue around it is also inflamed.
Thick.
This is the typical cavity of what? Of a tuberculous cavity. What could be? What is the differential diagnosis of this cavity? It might be a lung abscess. Yes, it might be a lung abscess, but usually the lung abscess, the patient is toxic and there is a fluid level there. In this patient there is no fluid level. Almost always there is no fluid level in TB lung abscess, lung cavity, unless the patient he got what? Hemoptysis a day or two before. And in TB cavity, this is the TB cavity. If this is turned to be TB and you find a fluid level there, ask the patient, you will give that he got what? Hemoptysis. And this is accumulation of blood. Usually TB cavity is what? Is an empty cavity. Empty cavity. This patient, her sputum was positive for AFB. We start her with anti-TB for 6 months, and this is the result. This is the result of our treatment. Dramatic response of the cavity, nearly disappeared. TB cavity, and the patient health returned normal. TB. We call this TB is a post-primary tuberculosis. Usually there is no lymph node enlargement in TB unless the TB patient got what? Primary tuberculosis, or the patient got secondary or post-primary tuberculosis and the patient is a nigger. You might get what? You might get a hilar lymph node enlargement of this TB cavity. TB is endemic in Iraq, and most of the cases usually here either kids, extreme age, kids or elderly patient. Tuberculosis. You see, there is a thin wall cavity, there is infiltrate around the cavity, there is sort of calcification. It means activity and healing at the same time. In this chest X-ray, this is calcification, and these are activity around it. Therefore, this is most probably tuberculosis. TB most probable.
فوكس تعتبر هاي
شنو؟
فوكس
One focus.
Gone. لا ليش هاي
One focus. Gone focus, as you said, is when the primary tuberculosis healed. You get a calcification in the periphery and a calcification in the hilum. This way they call it gone focus. This is active post-primary tuberculosis. This patient got primary while she is kids, and then at the age of 11 or 12 she get a post-primary. You might get primary tuberculosis go directly to the post-primary tuberculosis if the immunity of the patient is up and down. But in post-primary tuberculosis, usually the immunity is what is low.
صارت الage مال this patient she get
11 or 12. This patient is 11-year-old with this cavity. She had actually history, family history of tuberculosis. She had contact with the tuberculosis. A female, an elderly female with diabetes and had tuberculosis, and she get tuberculosis from her grandmother.
Okay. Another one.
Any question about TB?
مو سترينج يعتبر يعني هو younger age group بالميدل لوب.
This is not the middle lobe. The middle lobe in the right, here the middle lobe.
Lingula.
This is in the lower part of the upper lobe, and even not in the lingula, because the lingula is just attaching to the heart here in this area. This is the lower lobe, this is the lingula, and this is the upper lobe. This is a lower part of the upper lobe tuberculosis, left upper lobe. Usually tuberculosis in human, it's appear in the apices, but sometime you will see tuberculosis primary or post-primary in the lower part of what? Of the upper lobe. You might see post-primary tuberculosis in the lower part, what they call it lower lobe tuberculosis, which is common in younger age, as in this patient, and also in female. She is young age and she is female. If you consider this is the hilum, and this must be considered lower lobe tuberculosis. And I mean any tuberculosis. This is the hilum. Below the hilum, this area below the hilum, considered to be lower lobe tuberculosis. It is a tuberculosis, but usually occur in young age and in female. The frequency is not that good.
Start.
This patient is 65-year-old female with right side chest pain, shortness of breath, cough more than 1.5 years. She is a smoker, 20 cigarettes per day, more than 20 years.
Yeah.
What is this? We say that if we found in the chest X-ray an obvious lesion, we go right away to the obvious lesion. If we didn't see an obvious lesion, we go systematically. Trachea, central, apices, normal, upper zone, lower zone, mid zone, apices, angle, heart, diaphragm, below the diaphragm, etc., brace, etc. But in this case, because there is an obvious lesion, this is rounded, big rounded mass in the right side, nearly occupying the whole of the lung, except the apices and small part of the lower lobe. And the margin is a clear margin. There is no mediastinal enlargement, but there is a slightly deviation of the mediastinum to the left and the trachea to the left. What could be this?
احنا الماس ممكن نخلي بالنا انه يا اما malignancy.
Yes.
ممكن نخلي بالنا هاي.
Because she is a smoker, she smoked 20 cigarettes per day more than 20 years. Most probably This is a CA bronchus. When female smoke cigarette, they get CA bronchus just the same as in male, and also they get malignancy of what? Of the breast.
Yes.
Sequence.
Yes, they are more liable. We know that smokers are more liable to malignancy from the mouth till the anus. If this lady, she is a smoker for more than 20 years, lag period of smoking usually to causing malignancy not less than 10 years. Therefore, this might be a malignancy, a CA bronchus. And what CA bronchus look like this? We have 4 types of CA bronchus. We have the squamous cell CA bronchus, squamous cell, odd cell, adenocell carcinoma, large cell carcinoma. Which one of these is typical in this lady? If you see a big mass might be cavitating, then the mediastinum is normal. There is no mediastinum lymph node enlargement. This is most probably what? Squamous cell carcinoma. If you see a big mass, usually central, this is squamous cell carcinoma. If you see a big mass and this is peripheral and cavitating, multiple cavitation, this is usually large cell carcinoma. If you see a small mass peripheral in the periphery and might be cavitating, this is what? This is adenocarcinoma. If you see a big mass central with mediastinal enlargement, just like this, this is a mass and there is enlargement of the mediastinum. Wide mediastinum, this is odd cell carcinoma, and usually odd cell carcinoma doesn't cavitate, and usually odd cell carcinoma they have no clubbing and no cavitation. Therefore, most probably this lady got what? Squamous cell carcinoma. What other differential diagnosis might be? Because the history is dating back to 1.5 years. I mean, you know the doubling size of squamous cell carcinoma is what? By doubling, we mean if this is a tumor, rounded tumor, and the diameter is 3 centimeters, when the size of the tumor is double in size, there is increase in the diameter in 30%, 33%, 1/3. If there is increase in diameter in 1/3, suppose this is 4 centimeter become. Therefore, this tumor in the first X-ray and in the second X-ray increase in size to double, because the diameter is jumping from 3 centimeter to what? To 4 centimeter. Therefore, the size of the tumor is what? Is double. Any increase in the diameter of the tumor, of the mass, 30%, 33%, it means the size of the tumor is double. Therefore, suppose this is a chest X-ray, first chest X-ray, and this is second chest X-ray. We look for the time. If the time between the first and the second is less than 1 month, this is most probably odd cell carcinoma. If it is between, it is around 3 months, this is squamous cell carcinoma. If it is around 6 months, this is what? Adenocarcinoma. Therefore, most probably this is a squamous cell carcinoma in this lady. Probably this is a hydatid, we don't know. Probably this is hydatid. Actually, hydatid is the typical site of hydatid, usually in the lower zone and mid zone. Rarely you find hydatid in the upper zone, and the typical site of hydatid is between the lobes. This is the upper lobes, this is the, this is the upper lobe, right upper lobe, and this is the middle lobe, and this is the lower lobe. Usually hydatid in between the fissure. This is the site of the hydatid usually. I mean, causing damage of the middle lobe and lower lobe, and it mainly occur in the fissure in between. Hydatid disease. Usually, if you find hydatid disease in the lung, nearly 40%, 20 to 40%, you will find what hydatid were in the liver. If you see hydatid disease or cyst in the liver, nearly between 5 to 10%, some say 20%, you get hydatid in the lung. Therefore, most probably this is a case of malignancy, squamous cell carcinoma. The differential diagnosis of it is hydatid, and in neurogenic tumor also, sometimes we see neurogenic tumor, big tumor, and just like this. This is a chest X-ray of a 45-year-old male, shortness of breath, chest pain, cough more than 2 months. He is a heavy smoker, 60 cigarettes per day for more than 20 years. What's wrong?
اكو هنا بالليفت سايد اكو عندنا هاي calcification هايلر شادو موجود عندنا هاي.
Yes, there is some hilar shadow calcified. Probably this is all tuberculosis. You see there is a left diaphragm is above the right diaphragm.
يعني ممكن خلي بالنا كولابس.
Diaphragm elevation in the left side, in the right side. The causes of it are either a lesion in the lung, pull it up, or lesion in the abdomen, push it up, or there is paralysis of the phrenic nerve of that diaphragm. But this diaphragm is elevated because a lot of gas is there in the stomach in this patient. Okay? What's wrong? If you see chest X-ray and there is no obvious lesion, you go systematically. Trachea is what? Central. The heart size is what? Normal. The angle is normal there. The angle is normal. Angle here is normal. The vertebra is straight. Nothing below the diaphragm except the gases of stomach. Apices are clear. Mid-zone, upper zone, mid-zone, lower zone are clear. The hilum is clear apart from this pulmonary artery, and this is calcified lymph node. And there is a dirty chest X-ray of a chronic bronchitic patient, but there is an obvious lesion. Also, you say the ribs are not notched, neither below lower end nor upper end of the rib. Notching. There is no notching in this chest X-ray. Extrathoracic lesion, there is no extrathoracic lesion. But there is an enlargement of what?
Thyroid.
Of the thyroid. Of the thyroid is enlarged there. He got a thyroid goiter. What could be this goiter? Might be this is a Graves' disease causing thyroid enlargement, but usually Graves' disease occur in what? In female. And this is the patient is male. And he is not an elderly to say this is a nodular toxic goiter. Therefore, might be this is a Graves' disease in a male. Yes, the percentage between male and female 8 to 1, but it might be. There is an obvious lesion, spot diagnosis. This is, look for this white and this white line. what they call this. This is what I call it a zygous fissure. A zygous fissure. This is a zygous fissure is a rare. The prevalence of it is less than 0.1% of a chest X-ray. It is of no significance usually, but it might show some diseases specific for a zygous fissure. Yes, therefore, most probably this is a dirty chest X-ray of a chronic bronchitic patient with thyroid enlargement, might be thyrotoxicosis, Graves' disease.
I best point to a zygous fissure. Point on it, Ammi.
Yes, a zygous fissure usually occur in the right. It is rare in the chest X-ray. The prevalence of it is less than 0.1%. 0.1% is rare. And of no significant, of no specific disease. Sometime it become a lobe, a zygous lobe they call it, when the pleura is pushing back to get a lobe. Certain disease might occur in that lobe. Yes, therefore we present this chest X-ray to let you describe a chest X-ray, look to you in front in the first see, in the first vision as normal. You go systematically and you will find systematically trachea, central apices, clavicle, bone, ribs, angle, heart size, below the diaphragm, above the diaphragm, anterior, away from the chest, extra chest, and the neck. You will see a lot of lesion if you go systematically.